Good evening, and welcome to today's webinar briefing, 100 Days, 100 Harms. I am Kimberly Wills. I'm the Director of Strategic Partnerships with the Climate Action Campaign. We're hosting this webinar in partnership with Physicians for Social Responsibility. And just to note, this webinar is being recorded. Thank you so much for joining. April 30th marks 100 days of the Trump administration, and we're gathered here today to talk about the harms to climate and health that we've seen so far and how you can use your voice as a health professional and an expert to stand up for our climate and for the well-being of our communities. First, we'll hear from our key speakers, then I'll talk about actions that you can take right now and in the coming weeks, and we will have time for Q&A before we close. Now, to start us off, I am pleased to introduce Congresswoman Maxine Dexter, MD, of Oregon's 3rd Congressional District. Congresswoman, thank you so much for joining us, and the floor is yours.
Good evening, everyone, and thank you, Kimberly, for that introduction. I am Dr. Maxine Dexter. I'm also the proud Congresswoman for Oregon's 3rd Congressional District, which includes the vast majority of Portland, Oregon. I'm also a pulmonary and critical care physician who spent over 20 years taking care of the sickest members of our community. I entered public service because I saw firsthand how policy, how policy fails to meet the moment. We are harming our patients, and I'm here today because those harms are escalating. Over the past 100 days, Donald Trump has brought a dangerous mix of chaos, cruelty, and corruption back, unfortunately, to the White House. His administration is, frankly, wasting no time in dismantling the very protections that keep our communities healthy, safe, and resilient. And let's be clear, Trump's first 100 days have been an assault on our environment, our democracy, and our children's future, all of our future. He's moved swiftly to roadblock protections against pollution, hand power back to big oil, and erase science from decision-making. As the ranking member on the Oversight and Investigation Subcommittee on the Natural Resources Committee, I am seeing firsthand the way science and data are being manipulated to tell a tale that does not meet the verity that we all need and deserve. He's pulled us backward in the face of worsening climate crisis, and he's stripped really critical federal agencies of their ability to prepare for the extreme weather events we all are knowing that continue to come and increase in severity. As a physician, I'm not just watching this happen, I'm seeing the results. In Oregon, we've had record-setting wildfires. We have had heat dome events that have killed disproportionate numbers of our community in our most vulnerable areas that are least capable of dealing and adapting to the harm that the climate change is wreaking on our communities. I've treated patients with asthma exacerbations, heat stroke, respiratory failure due to the thick, toxic smoke that blankets our state for days and weeks on end in the summertime, and seniors with COPD, kids from communities that are marginalized with asthma, farm workers who are forced to work without respiratory protection are just the beginning of all the harmed communities that we are looking at and taking care of in our health facilities. This isn't abstract. This is real. Donald Trump is actively making it worse. And in fact, it feels like cruelty is the point, that those communities who do not have the ability to build resilience are not valued. The members of our community, low-income communities of color, indigenous populations, unhoused neighbors, and immigrants who are working so hard to make a new life for themselves and their families are disproportionately the sickest and suffer the most. And his priorities, Donald Trump's, can't be clearer. He's protecting polluters and abandoning people. But we're not powerless. As a physician, I deeply believe in science and am dedicated to bringing data to policymaking. And as a member of Congress, I believe in accountability. As an Oregonian, I believe in protecting our communities and fighting for our future. This is a shared value that nearly every Oregonian holds dear. And that's why I'm calling on all of us, especially those of us in the health professions, to speak out. Doctors, nurses, public health experts, science bench researchers, your voices matter. You're trusted messengers, and your lived experience treating those who are harmed by these decisions and policy changes make you powerful advocates for people who can't speak for themselves. So don't wait. Contact your members of Congress. Our office is absolutely delighted to hear from folks who want to assert their values and help us fight for them. Sign petitions, show up to rallies, testify at hearings. Your voices do have power. And we need your advocacy more now than ever. Because while Trump is working to dismantle, we must keep building and keep fighting for a future where our children can grow and our families can be safe and secure, building resistance, building communities, building hope. In Congress, I will continue to use every tool at my disposal. That's legislation, clearly as a lawmaker, but also litigation. I've joined innumerable now amicus briefs in the courts, and we need agitation. We need people showing up in the streets and using their voices to elevate the things that are on their mind. We are in this together, and together we cannot and will not allow our democracy and our planet to be sacrificed for greed and extremism. I really appreciate your being here. I appreciate your advocacy, and I hope to hear from many of you now and moving forward. Thank you so much.
Thank you so much. So grateful to have you today. So grateful for your leadership. We really appreciate you, Congresswoman. Next, I'd like to introduce the Executive Director of the American Public Health Association, Dr. Georges Benjamin. Dr. Benjamin.
Thank you very much, Kimberly. I always love following Congresswoman Dexter because, having someone who's actually put on the white coat and had to take care of patients and understands the critical linkage between climate change and our health is just so important. Let me put a little different slant on this. Right now, members of the House are trying to find over $800 billion, and they're looking at the Medicaid program to try to find that money. It turns out that I got another pay for. It's the fact that we spend over $820 billion annually on healthcare costs because of climate change. So think about it. We can help find the money. It's cost avoidance by doing the right thing on an annual basis to try to improve our health. We know that climate change is here and is impacting our health today. We know that this really matters to the health of the population because just think about what we've gone through over the last year or so. We've gone through wildfires where we've had people who were not only lost everything, but people died in those fires. We know that the heat waves we're seeing are much more frequent, and we know the impact of these heat waves on our communities. And of course, the severe storms that we're seeing, too much snow in some places, too much heat in some places, too much rain and wind in other places. Just think about what's happened with Hurricane Katrina, where we actually had to totally relocate the whole health system in New Orleans at an extraordinary cost. Think about Hurricane Sandy in 2012, where we had over $32 billion of damage, disruption in our academic health system, over 12,000 health-related events between hospitalizations, outpatient clinic, and emergency department visits. We had over 273 premature deaths from that. And of course, increasingly, we're having more and more of these severe storms each and every year at enormous ongoing costs. And then we have the long tail of climate change, the toxic exposures that happen when we have total destruction of a community that pollutes our water. We saw this in North Carolina this year when we just simply had torrential rains and floods. And of course, nobody expected it. You know, Asheville was supposed to be a climate-proof community, and yet we now know that there is no community that is safe from harm from climate change. We clearly need to do this. We need to do this through policy. And our concern, of course, is that the Trump administration has signaled on many occasions that they will reverse the policies and rules that we have put in place for so many years, undermine the efforts of the Clean Air Act, undermining the efforts of the Clean Water Act. The challenge that we have now is that we don't have a public health agency at the Environmental Protection Agency, assuming that they're going to do the things that they have said they're going to do. And right now, it's so important for us to treat carbon, continue to treat carbon as a pollutant, which is the basis for the limits on greenhouse gas emissions from both vehicles and power plants. We must not allow that policy to change as we're going forward. We also know that public health officials are on the front lines, whether treating patients or building community resources to promote resilience, whether or not they're doing emergency response, bringing in portable water, making sure the food is safe to eat, the air is safe to breathe, both before and after these kinds of events. And of course, now the administration has totally taken apart the nation's public health infrastructure. They're demolishing the climate program at the Center for Disease Control and Prevention. They're indiscriminately firing people. They're indiscriminately cutting the budgets. And of course, the vast majority of the funding that happens from the federal level goes to our local communities. And so we need to do a better job of helping people connect the dots between what's happening at the national level and what's happening at the local level. It's a real problem for us going forward. And so I am encouraging us all, particularly in the clinical world, to step up and speak up, protect our patients, and recognize that we haven't done our jobs unless we're advocating for strong climate policies and clean air and safe water to drink. With that, I'll turn it back over to you, Kimberly.
Thank you so much, Dr. Benjamin. I appreciate your expertise and your perspective. Next, I'd like to introduce Dr. Mark Vossler, President of Physicians for Social Responsibility, to dig a little bit deeper on the specific harms that we've seen in the first 100 days to our climate and health. Dr. Vossler, the floor is now yours.
Thank you, Kimberly. While there are adverse human health consequences of the majority of the Trump administration's policy decisions, and it's more than 100, I'm afraid, I'm going to need to focus on the harms due to adverse environmental exposure, and even with that limitation, I can't cover everything today. I have a friend and colleague in my PSR chapter who sends me multiple news articles daily about what's going on, and I think that he feels that's his role. He's empowering me with the news. We can't cover it all. And I picked some of the things I think are most dangerous in terms of environmental exposure, but I don't want to give anybody the impression that things that we don't have time to cover aren't important or aren't harmful. And maybe we'll touch on some of that in the Q&A, or maybe we'll have to have a second or even a third webinar. Things I'm going to focus on are the power plant pollution protection rollbacks and the mercury standards for fossil fuel plants, the particulate matter air quality standard rollbacks, the elimination of the National Center for Environmental Health at the CDC, the termination of EPA environmental justice offices, cuts to firefighting and fire prevention services at the Forest Service, and reversal of the endangerment finding regarding the health impacts of greenhouse gas emissions. As a cardiologist, I have seen firsthand the impacts of poor air quality on my patients. It's not theoretical. I specialized in congestive heart failure, and it tended to be older, chronically ill patients who, when our AQI was high, landed in the emergency room, and would report when they come into clinic and say, well, how are you doing? I said, well, they'd say, well, today's okay, but last week was horrible with wildfire smoke, for instance. So it's not just hypothetical. It's real. let's talk about power plant pollution's protection. So the carbon pollution standards being rolled back and taking away mercury toxic air standards is exceedingly harmful. And because these plants aren't just emitting carbon, they're emitting mercury, arsenic, sulfur dioxide, particulate matter. And this is associated with a host of human diseases: cancer, lung disease, developmental delay, cardiovascular disease, and much more. Mercury itself is a potent neurotoxin, and developing fetuses and young children are particularly vulnerable to the impacts. These rules that are in place but expected to be rolled back, these rules were expected to prevent 1,200 premature deaths annually and generate 370 billion in health benefits over the next decade. And by health benefits, we're talking about preventing lost days of work, reducing the costs of care due to the illnesses. And actually, it's 2 decades, not one, but 370 billion. It's a lot of money. And this is just one small part of Secretary Zeldin's plan to roll back 31 environmental protections at the EPA. The other, the particulate matter rollback is particularly damaging. This ambient air quality standard was an opportunity for businesses, manufacturing to kind of work together with the federal government to reduce harms. Small particulates known as PM 2.5 are inhaled deep into the alveoli and set off a cascade of inflammation, causing injury to the lung tissue, the vasculature, and the brain. PM 2.5 is associated with heart attack, stroke, cognitive decline, and both the acute exposure and the lifetime cumulative exposure are really important in the disease risk. What interests me most about PM 2.5 is almost any change in the concentration upward is associated with increased harm, and any change downward in the ambient concentration is associated with health benefits. For instance, the old EPA standard of 12 micrograms per meter squared was associated with a 6% higher risk of death than a level of 3 micrograms per meter squared. The standards were tightened up last year, and even the 9 microgram per meter squared level still has a 2% higher risk of death than baseline. So even the standards we're doing away with were probably not quite good enough. The current standards, however, were estimated to prevent up to 4,500 premature deaths and 290,000 lost work days and 46 billion in net health savings, again, in about the next decade. So rolling back these standards will clearly cause harm. And what really gets to me is we can do this. The technology to reduce particulate pollution is not fancy stuff, and the benefits are really immediate of reducing exposure. Okay, Dr. Benjamin alluded to this, the elimination of the National Center for Environmental Health at the CDC. This is egregious. Okay, so basically what they're doing here is saying, let's just stop looking at the problem. Let's stop studying it, because if we don't know about it, it can't hurt us, right? That's pretty stupid, okay? And what you need to understand about this department of the CDC is, while it was a small unit, it really worked with state and local health departments to empower them to take action. And now the state and local health departments are on their own with regard to environmental health. These cuts did away with CDC expertise in asthma and air quality, childhood, lead poisoning prevention, radiation health, water pollution, and in climate change. So the local health departments are now pretty much, they're on their own without this assistance. Again, it's egregious. We do not need to cut this from our federal budget. Terminating environmental justice offices. Frankly, this is just straight up racist. There's the plan announced by the EPA is to pursue a reorganization and elimination. The key word here is elimination of offices of environmental justice at all 10 EPA regional offices and the one in Washington, D.C. Without these offices, the regulatory enforcement will be weakened, and be weakened particularly in communities that are already disproportionately impacted by pollution. And let me be clear, the burden of air and water pollution is not equally shared. Low-income communities, communities of color, suffer outsized harm. Failure to acknowledge this inequitable exposure and act to reduce the same will propagate ongoing disparities in health outcomes based on race and income. These disparities include childhood development and mortality in adults. If this weren't enough, we're cutting fire prevention staff at the Forest Service. And, this hits me locally. I live in Washington State, and the biggest factor in air quality in the Intermountain West is wildfires. We can go from like the safest air in the world to the dirtiest air in the world overnight. The cuts that are proposed by DOGE include the backbone of wildlife firefighting, the collateral duty firefighters who work on trails, soils, communications, and this really leaves us poorly positioned going into this fire season. Forest fires, as I said, are the major source of air pollution in the West, but the smoke isn't limited to the West. We can have a fire in British Columbia with smoke ending up in New York City. We can have a fire in California and have the smoke in Seattle. And fires are now cropping up in areas of the country that, like December wildfires in New Jersey. Like that wasn't a thing when I was a kid. And this is not a time to be cutting back on this. My pediatric colleagues in Washington State have shown clear evidence that a significant uptick in emergency room visits for kids with asthma on bad air quality days during the fires. The Mendocino complex in 2018 in California was studied, really good study looking at cardiovascular impacts. There's a 23% increase in major cardiac events. That means getting hospitalized for angina or having a heart attack or a stroke. 23% over baseline during the fire, and a 36% increase in mortality. So preventing forest fires is clearly preventing premature death, and we can't really afford to cut back on this now. And that's not even to mention the long-term climate benefits of having those trees not burn down and sequester the carbon. Finally, the endangerment finding. Basically what this means, in 2009, the EPA announced that current and projected concentrations of the 6 greenhouse gases threaten our health. This is the basis to regulate greenhouse gas as a pollutant and to recognize that climate change actually has health impacts. Rolling this back is another example of if we don't know about it, if we don't study it, then it can't be harming us. It's really a do nothing, head in the sand approach. And this leads us vulnerable to heat-related illness and all the other impacts of air pollution, because CO2 isn't emitted in isolation. So the bottom line is all the cuts and rollbacks I mentioned have adverse human health impacts. All of them increase healthcare costs. All of them reduce productive days work. They're economically insane. It is very short-sighted to try to save money now, I guess, so that we can keep the tax cuts, save money now, and increase costs over the next 10, 20 years. And not only increase the financial costs, but increase mortality. So with that, I'll turn it back over to Kimberly to talk a little bit about what we can do about it.
Absolutely. Thank you, Dr. Vossler, for your expertise and your commentary. And thank you for putting a finer point on why action is so important right now. So that is what I'd like to talk about for a couple of minutes. How you, as a health expert, how folks on this call who serve as health professionals in their community can leverage your voices to make a difference. The next few months are particularly critical. So you've heard today about the EPA's plans to roll back standards that limit harmful pollution. You've heard about the agency threatening to rescind the endangerment finding. And we believe that health professionals in particular are an important voice to mobilize in opposition. Nurses, doctors, and other health professionals are highly trusted by the public. You have deep expertise and, as others have said, experience with patients impacted by climate change. So we think that if we are well organized, we can weaken the administration's efforts to roll back pollution protections. So my first action for you today is an easy one. We have a sign-on letter. It is addressed to EPA Administrator Zeldin, opposing his agenda that puts polluters first. And with enough signatures, we can generate media attention, which is another strategy for weakening these attacks. So you'll see in the webinar chat here the link to the sign-on letter. And so I am asking everyone, inviting you to open that up right now. And I will pause for a moment and invite you to sign it. Thank you. I see folks are signing right away. Appreciate your advocacy and your activism. Again, this letter expresses grave concern at EPA's efforts to rescind pollution protections for millions. It details health risks like asthma attacks and health-related hospital visits, as well as describing healthcare costs. Appreciate everyone joining us in this action that you can take right now. I also want to make you aware of upcoming activity that will be a top priority for our community in the coming months. Like we've mentioned already, the rescinding of the endangerment finding is so important because this is a cornerstone of addressing climate change. We are expecting to hear an announcement about this quite soon. And we will be mobilizing our community in response and hope that you will join us. There are a couple of different ways that health experts could engage. You can testify at hearings. It could be virtual, could be in person. You can submit public comments if there is a public comment period. We don't know exactly how this will play out, but there's a good likelihood that there could be a public comment period. Also very important, given your position and stature as a health professional in your community, health experts can push back in the media by writing letters to the editor or op-eds, or even speaking to the media in an interview. I hope that you'll join us in these moments as well as signing on to the letter to the EPA. The advocates in our community will work hard to provide information to you when the time comes. We do have some time now for Q&A, so please submit a question in the question box. And I'll pause for a moment now to receive those questions, and I'll read them out to our panel, and we can get folks to take those. So please go ahead and type in questions. And I'm seeing Dr. Benjamin has already answered one question. I'll read it out loud so that folks can see. Is there one rollback or other action taken by this administration that you are most concerned about the health impacts of? Dr. Benjamin said the endangerment finding risk of removal is central. And Dr. Vossler agrees with that, I assume, based on his comments earlier.
Yeah, rolling this one back limits the ability for the EPA to take further action. So other actions on fossil fuels are dependent on the endangerment finding.
Other questions I am seeing from another attendee, PM 2.5, major triggers for flares of atopic dermatitis, lupus, dermatomyositis. Oh, can you tell I'm not a health professional? And psoriasis. That seems more like a comment to me, but invite our panel to comment on the comment as well.
I apologize for being vascular centric, Dr. Fiveson. The way PM 2.5 works for all the diseases it triggers is getting into the lungs and setting off a cascade of inflammation. And I apologize for only focusing on the heart and vasculature, but that's what I love. And it's dermatomyositis, Kimberly.
Thank you.
Um,
I do have another question. This one I can pronounce all the words, I'm pretty sure. How can clinical health professionals broach these topics and their concerning health impacts with patients?
Yeah, I wish my friend Stefan Wheat was here because he's been all about this group called Climate RX and teaching clinicians how to discuss this in the exam room and it just, to frame it on, what's happening to the individual. He's done some really great work. I have to say personally, I have been very vocal in kind of the local press and stuff about climate impacts and about air pollution. And I've never once had a patient come in and say they were firing me as a physician because I did that. In fact, most of the time it was gratitude. It's gratitude. I think now is the time where, I use the wildfire smoke example. There's gross climate related things happening. People are seeing how it hurts their own health. It's okay if you're a physician or a nurse to mention that to the patient. It's not political. It's about their health. I don't know if I actually answered the question, but
Yeah, let me deal with that. And I think people often think of, if I talk about this issue with my patients, that I'm going to be perceived as political. So first of all, you can have information in your waiting room about climate change and health, just like you have all kinds of other brochures in your thing. And you could talk about them specifically with their problems. So you have people who have challenges with respiratory conditions or cardiovascular conditions. You can talk about how the temperature, how the weather, what happens on cold red days as part of your broad patient education. And you certainly say, look, climate change is making this worse. So, all you have to do is help them connect the dots. Your patients are pretty smart. They're just waiting for you to help them validate what they're already seeing and already know.
Thank you.
Just don't lecture to them.
All right, another question. I think I can answer this one. The question is, are there any advocates in Congress presently that are on our side, quote unquote? How do we support them and write to their office in appreciation of their work? Congresswoman Dexter did have to jump off pretty quickly. She's a busy lady. But yes, there are champions in Congress fighting for a livable climate. And, we talk a lot in advocacy about accountability and reaching out to our members of Congress when we are concerned they may take a vote that we don't support. But it goes a long way to thank your members of Congress as well. in your toolbox is always the option to call up your member of Congress and say, as a physician in your district or your state, I care deeply about climate change and its impacts on health. Thank you for your leadership, and I urge you to continue standing strong. A message like that does not have to be super specific. It does not have to be really detailed. Don't let that hold you back. Reaching out and sharing your where you come, what your profession is, and your concerns goes a long way, and thank yous go a long way as well. All right, I'm going to take a second and read the questions that are coming in. Oh, this is an interesting one in terms of the logistics of information sharing. Somebody says, it is so easy having a link to the letter to the EPA chief. Could such a link be added to the patient portals like MyChart that a PT could click, sign, and send? Having not worked in the health profession, I'm wondering if either of you have a comment on some of those systems.
Yeah,
I don't know if you can do the advocacy through the federal portals, through those portal systems might be a little challenging. But if you can certainly send emails to your patients as part of, again, doing it in a way that doesn't be viewed as political, just around patient education could be very helpful.
Thanks for that take. How will the recent reduction in force of EPA environmental justice staff impact vulnerable communities and the government's ability to address their needs?
Yeah. Again, yet another example of pretending that the problem doesn't exist. So if you say we're going to just eliminate environmental justice offices, it's essentially saying that health disparities don't exist based on income and race, which is false. And so, of course, communities of color, low-income communities that live in proximity to the plants, and the classic example is Louisiana's Cancer Alley. You have these fossil fuel facilities. You have communities that are already overburdened. And then what you do is you just do away with the staff that are actually studying and working on the problem to reduce that disparity. So that act amplifies the impact on those communities of rolling back all the other regulations. It doubles down. And so what I see happening is the people that are suffering the most now are going to suffer even worse in the future.
Thank you. All right, we have time for just another question or two. A question for PSR specifically. Is PSR helping with getting out non-biased environmental health and medical info since the administration is hamstringing NIH, CDC, et cetera, and removing information and research?
Yes, but you have to understand we have a environmental health staff of 3. It's not like there's no way that PSR can duplicate or replicate what's being lost in the federal government. And I would be interested to hear from Dr. Benjamin what he thinks the APHA is able to do, because we're struggling with this. We can't do what the federal government was doing.
Yeah, we'll never be able to do what the federal government is doing. But we are, for example, picking up the BRACE model that CDC had, and we'll be able to promote that publicly. So to the extent that we can take the work we've been doing with CDC, a lot of updated material, a lot of material has been updated in the last year, and more actively promote that. We're going to do that. We, of course, have a Center on Climate Health and Health Equity here at APHA. We're always looking for, people who want to invest in that center because it's a really good center. Certainly this is my fundraising call. But I think us PSR organizations that are in this space are groups that need to have your support and engage in our activities. So sign on our advocacy letters, to engage in our social media conversations, show up for the webinars that we have, come to our annual meetings that we have on science and the evidence around things around climate. I think those are all ways that you can improve your skills and find ways to advocate for our priorities, that we are very focused on improving the health and well-being of communities.
Thank you so much. I'm going to take two more questions. The first is, how will cuts at EPA, HHS, NOAA, DOI, and more impact the public perception of climate change and its impacts on health? Dr. Benjamin, could you take a stab at this one?
Yeah, they're going to be there'll be less announcements from authoritative sources that the public sees as authoritative. Now, all of our nonprofits like to think of ourselves as authoritative as well, but when your governor says something, it means something. And they also pull together materials in a very effective way that we can then propagate out and share with the community. So it will hurt because we lose that moral authority. The other thing that happens is the federal government is able to nationalize the conversation a bit more. And they can also take advantage of tragedies like when a wildfire hits to both talk about prevention and remind people things you can do when these bad things happen. And they can nationalize that conversation. So when the wildfires occur up in the Pacific Northwest, it can improve the response for people in Southern California, or when that smoke begins to move across the country, they can again engage in public education in ways that those of us who don't have the resources of the federal government cannot do.
Thank you. I'm going to do one more question. I'd like to take a stab at an answer and then invite both of you to weigh in as well. The details discussed here are extremely important, but the larger issue is the fundamental attack on democracy and the movement towards autocracy. How can we as physicians not only leverage our expertise on the health impacts of climate change, but also use our trusted position to protect democracy? I think that one of the most important things in this moment is to engage. One of the reasons to hold a briefing like this is to inform you, this community, but also to inspire and to motivate and to help make clear how you can raise your voices and leverage your expertise. So I think engaging in our democracy is so important in this moment. And I hope that you will do so by signing our sign-on letter and preparing yourselves to take action in when the endangerment finding fight begins to heat up. So please stay tuned for more. Please be prepared to testify at public hearings, to call your members of Congress, to submit comments. All of that activity is so very important.
I would agree. Get to know your elected officials and write them letters, make phone calls. They respond to that. You heard Congresswoman say earlier that it is important that they get to know, and it's always important that they get to know you before they need you or you need them. So I would encourage you next week, get to know your elected official, write them a letter, let them know you're a constituent. When I go in, they know what I'm going to say. I'm representing a national organization, but you carry weight as a constituent, a lot more weight than I do. And so when they hear from you, they care. By the way, you vote for them, and they know you vote for them. So your opinion absolutely matters. And you ought to say, climate change is here, is impacting my patients, is impacting my family. I want you to do something about it. And far too many members of Congress are able to say, nobody contacts me on this issue, so obviously there's no problem.
Thank you, Dr. Benjamin. Any thoughts, Dr. Vossler?
Yeah, I've been meeting with members of Congress for over 10 years about climate change. And I always ask at the end of the meetings, what can we do, back in the district to help you do the right thing? And the answer is always, you need to get more people to contact me like you are doing right now. Our elected officials are feeling the threat to democracy, which is making it hard for them to act on any of the things we talked about. Take this question head on. And Lisa Murkowski is quoted in the New York Times earlier this week about being afraid. And actually, people out there in the streets protesting peacefully, holding your signs, that is actually having their back. The people that are afraid to speak up about the changes that are occurring, the threats to voting rights, as well as all the environmental threats that we just discussed. I'm not advocating for disruption. I want to be crystal clear, but the hands-off protests, being visible, making your voices heard. So it's that. It is calling Congress. It is calling your state legislature and being persistent, not making it a one-time deal, but making it a habit. And showing up at town halls and asking the question about climate change and health. Because that not only tells the elected official, but it tells all those other people who are attending that town hall that this is an issue that they ought to care about too.
Thank you. That's all for today. So let's go ahead and wrap up here. I want to say thank you so much to our panel. I want to say thank you so much to our attendees. I am looking forward to continuing to work together. Thanks for your advocacy. More to come. That's all.
Great.
Take care,
Thank you.
everyone. Have a good night.
It's an honor. Appreciate it.